Hello friends, welcome to the channel Dewdear Academy. In this video, I am discussing the MSc Nursing 2018 question paper. And this is the part 2 of the question paper discussion. I have already uploaded video, the part 1. So you can watch that video also. So this is the first question. Which one of the following vitamin is synthesized by intestinal bacteria? Which one of the following vitamin is synthesized by intestinal bacteria? The options are vitamin A, vitamin D, vitamin E and vitamin K. So here the correct answer is vitamin K. Vitamin K is the correct answer. Vitamin K is synthesized by intestinal bacteria. So what about vitamin K? It is necessary for coagulation. This vitamin K is necessary for coagulation. And there are two forms of vitamin K, that is vitamin K1 or and vitamin K2. So vitamin K1, it is also known as phyloquinone, and vitamin K2 is also known as menaquinone. So there are two forms, vitamin K1 and vitamin K2. And vitamin K1 is mostly found in green leafy vegetables. It is mostly found in green leafy vegetables. And vitamin K2 is synthesized by intestinal bacterial flora. Vitamin K2 is synthesized by intestinal bacterial flora. So here the question, which of the following vitamin is synthesized by the intestinal bacteria? The correct answer is vitamin K. Then the second question, all are true regarding disinfection protocol except. All are true regarding disinfection protocol except. Options: for non-critical devices, decontamination is enough. Semi-critical devices are those which come in contact with mucous membrane. Then for semi-critical devices, low-level disinfection is enough. And the last option is cardiac catheter is a critical device. So these are the options. So all are true regarding the disinfection protocol except. So among these options, one option is wrong. Find out that wrong option. So in this question, we should know here the Spalding classification. Spaulding. The Spalding classification. I will write once more correctly the spelling. Spaulding. The Spalding classification system is there. This is the classification system or the classification of the devices or the items. That means it can be classified into three. We can classify into three. First one is critical items, critical devices. Second is the semi-critical devices. And the third one is the non-critical devices. So, critical devices means the medical devices that enter the sterile tissue. It enters the sterile tissue. Okay, so all these items should be sterile when we are using. All the critical devices which we are using should be sterile. So we can give the example like the surgical instruments, all the surgical instruments, then endoscopic accessories, endoscopes used in the sterile body cavities, then cardiac, vascular or urinary catheters. All these are examples of critical items. Then what is semi-critical items? Semi-critical items are the medical devices that come in contact with non-intact skin or mucous membrane. Okay, semi-critical devices are medical devices that come in contact with non-intact skin or mucous membrane. And what about the disinfection of these type of semi-critical items? These items should be disinfected. That they should be high-level disinfection should be done. Okay, these items should be high-level disinfected when we are using it. Example for the semi-critical items are vaginal and rectal probes, then anesthesia equipments, laryngoscope, bronchoscope, then gastrointestinal endoscope and accessories. So all these instruments should be high level disinfection should be done. They are entering into the mucous membrane. They are coming in contact with the mucous membrane. Then non-critical devices. We can see the non-critical devices. What is non-critical devices? Non-critical devices for such items means these medical devices come in contact with only intact skin. Okay, they are coming in contact with intact skin. Okay, so clear. The semi-critical devices, they are coming in contact with mucous membrane, and the critical devices, they are coming in contact with the sterile body parts or body areas. Okay, the critical devices are coming in contact with the sterile tissue. Okay. So the non-critical items we are continuing, that is non-critical items, they are coming in contact with the intact skin. And we can give the examples like non-critical items, blood pressure cuff, BP cuff, then bedpans, stethoscope, linens, tourniquet, all these are examples of non-critical items. So with this type of non-critical items, how they are, the disinfection is done. Non-critical items are disinfected, means a low level or intermediate level of disinfection is needed here. So low level of disinfection is needed in non-critical items. For semi-critical items, high level of disinfection is needed. And for the critical items, the sterilization is needed because all these items or devices are entering into the sterile body areas or sterile body parts. So with this basic information, we can read this question. So the first question, the first option is, for the non-critical devices, decontamination is enough. Okay, for non-critical devices, decontamination is enough. That is true. Okay, this statement is true because low level disinfection is only required, non-critical items. So that statement is true. Then semi-critical devices are those which come in contact with mucous membrane. Semi-critical devices are those which come in contact with mucous membrane. So that we already discussed semi-critical devices. You can see here the semi-critical devices are coming in contact with mucous membrane. So that statement is also true. Then for semi-critical devices, low level disinfection is enough. That is wrong. For semi-critical devices, we can see semi-critical devices, high level disinfection is enough. So this statement is not correct. All are true except this statement. Then we can see the last one also. The cardiac catheter is a critical device. Yes, cardiac catheter is a critical device. Critical device means all those devices that are entering into the sterile body tissue. So all those devices should also be sterile. Example, we can give cardiac catheter is an example. Urinary catheter is also an example. So here this statement is also correct. And the statement 3 or third statement is not correct. For semi-critical devices, low level disinfection is enough. That is a wrong statement. Okay, so this is the answer. This is the answer. Option C is the answer. All are true regarding disinfection protocol except for semi-critical devices. Low level disinfection is enough. That is the wrong statement. So answer is option C. Okay. Then the next question. In the first week of illness, typhoid can be best diagnosed by. In the first week of illness, typhoid can be best diagnosed by. Options: blood culture, feces culture, urine culture, Vidal test. So here the correct answer is blood culture. Blood culture is the correct answer. Blood culture is the correct answer. The first week of illness, typhoid can be best diagnosed by blood culture. So patients with typhoid or paratyphoid fever, they have bacteremia. Bacteremia will be present for patients with typhoid and paratyphoid fever. And so in such cases, blood culture is the mainstay of diagnosis in typhoid fever. Okay, blood culture is the mainstay of diagnosis because the sensitivity of blood culture is highest in the first week of illness. The sensitivity of blood culture is highest in first week of illness. The first week, the blood cultures are positive in 90 percentage. First week, the blood cultures are positive in first week in about 90 percentage. So, this is the mainstay of diagnosis in case of typhoid fever. And the stool culture is not usually positive during the first week of illness. And also urine culture has also lower diagnostic yield than the stool culture. So feces culture and urine culture has, it is not usually positive. And Vidal test is unreliable, but still it is widely used in developing countries because of the low cost. But Vidal test is unreliable. It measures the elevated antibody titer in patients with recent typhoid fever, but they may not accurately distinguish the acute from past infection, and also they may have the more false positive result. So it is not that much, not much effective. It is unreliable. Viral test is unreliable. In the first week, it is one is the main answer is blood culture. It is the mainstay of diagnosis. Then next question. Which one of the following is used to monitor the autoclave performance? Options are Bacillus cereus, Bacillus stearothermophilus, Clostridium perfringens, and Clostridium tetani. Which one of the following is used to monitor the autoclave performance? Here the correct answer is option B. Option B is the correct answer, that is Bacillus stearothermophilus is the correct answer. Option B is the correct answer. So this Bacillus stearothermophilus, it is a thermophilic bacteria. Bacillus stearothermophilus means it is a thermophilic bacteria. First we should know that this bacteria is a thermophilic bacteria. Means it can grow at 65 degrees Celsius of temperature and above. This bacteria can grow at the temperature of 65 degrees Celsius temperature and above. So that is the peculiarity of this type of bacteria. It is a thermophilic bacteria, and the spores are highly heat resistant, and so they are used in monitoring the autoclave performance. They are highly resistant. The spores of this bacteria are highly resistant, heat resistant, and thus they are used to monitor the autoclave performance. That is mainly bacteria and viruses. Therefore, if they are destroyed during sterilization, it is assumed that all other life forms are also destroyed. If this bacteria is destroyed during sterilization, it means that all other bacteria or all other life forms are destroyed by when we are doing the sterilization. So this bacteria is used to monitor the autoclave performance or for testing the autoclave efficiency. The next question. An HIV infected patient is presented with chronic meningitis. Microscopy shows encapsulated yeast cells with budding in India ink preparation. Probable diagnosis is options Aspergillus, Candida, Cryptococcus, Histoplasma. The question is, an HIV infected patient is presented with chronic meningitis, and the microscopy shows encapsulated yeast cells with budding in India ink preparation. So what is the diagnosis? So here the correct answer is option C. Option C is the correct answer. Cryptococcus. Cryptococcus is the correct answer. That is Cryptococcus. Cryptococcus neoformans. It is an encapsulated yeast. Okay, Cryptococcus neoformans. This is an encapsulated yeast. Encapsulated yeast. And This grows and it replicates by budding. Okay, this type of Cryptococcus neoformans replicates. This type of yeast replicates by budding. Okay, it replicates by budding. Okay, in case of patients, that is patients with advanced HIV, there is chance of most common invasive fungal infection that affecting the central nervous system is this Cryptococcus neoformans. Okay, this Cryptococcus neoformans, it is the most common invasive fungal infection of the central nervous system. Okay, invasive fungal infection of the central nervous system in patients with advanced HIV. In patients with advanced HIV. Okay, so this Cryptococcus neoformans is the most common invasive fungal infection of CNS in patients with advanced HIV. And the peculiarity of this is it is encapsulated yeast. Okay, and it replicates by budding. And so when by doing this India ink preparation, by assessing the microscopy will be showing encapsulated yeast cells with budding while doing the India ink preparation. So here the correct answer is Cryptococcus. Correct answer is Cryptococcus. Okay, the next question. If there is delay in transport, which of the following specimens should not be refrigerated? If there is delay in transport, which of the following specimens should not be refrigerated? Options are feces, pus, urine, CSF, cerebrospinal fluid. So here the correct answer is option C. Option C is the correct answer. Correct answer is option C, cerebrospinal fluid. Okay. So what about this cerebrospinal fluid? Regarding the transportation of CSF, it should be transported immediately to the laboratory without any delay. Actually, this CSF transportation, it has to be transported immediately without delay. And if there is delay expected, in such cases, it should be kept in room temperature. Okay, it should be kept in room temperature. If delay is there, means the specimen should be held at room temperature. CSF should not be refrigerated during the transport and storage because certain organisms like Haemophilus influenza, then Neisseria meningitidis, then Streptococcus pneumonia, these all organisms they are sensitive to low temperature and they may be killed. Okay, some of the organisms like Haemophilus influenza, Neisseria meningitidis and the Streptococcus pneumonia, these organisms are sensitive to low temperature and they may be killed. So, CSF should not be refrigerated. Okay, if there is delay means they should be kept in room temperature. Okay, thank you. Thank you for watching this video. Hope you all like this video.